Hello and welcome back, guys. Yesterday we learned about what is the intrauterine fetal death, and today we are going to learn why there is decline in the incidence of intrauterine fetal death and what are the causes for the same. So, there are gradual decline in incidence of intrauterine fetal death. First one is the preconceptional care. In today's era, the couple who wants to conceive are consulting the doctor for their future baby. So the doctor prescribed prenatal vitamins and health education given to the couple so that couple knows about their condition, the fetal condition, the future pregnancy outcome, and so much things are changing over the period of the time. So nowadays there are less incidents of intrauterine fetal deaths. The second one is the care during pregnancy. The care given during the pregnancy is changing dramatic decrease in the incidence of intrauterine fetal death. The patient does regular antenatal visits, regular ultrasounds done with color Doppler facilities, which gives clue about the fetal conditions and termination of pregnancy as early as possible if there are chances of intrauterine fetal deaths. The third one is the care during labor. The continuous CTG monitoring gives idea about the fetal heart rate. If there are fetal compromise, we could take baby out by cesarean section and decreasing the chance of intrauterine fetal deaths. The PV examinations. The PV examination done during labor gives idea about if the baby has passed meconium or if there is abruptions or any other causes which can lead to fetal compromise, so that we can take baby out by cesarean section, thereby decreasing the chance of fetal death. The fourth one is provision for prenatal diagnosis and selective termination in congenital anomalies. Nowadays we can do ultrasound at around 20 to 22 weeks to rule out any congenital anomalies in the babies. So if we found any congenital anomalies in the baby, we can selectively terminate the pregnancy and take the baby out. Now we are going to learn about the etiology. So what are the causes for intrauterine fetal deaths? So there are multiple causes, from which the most common cause is idiopathic. Idiopathic causes are most common causes which can lead to intrauterine fetal deaths. Despite every possible thing we could done, there are certain chances of intrauterine fetal deaths which are unavoidable. The second most common cause of intrauterine fetal death is due to the fetal conditions. Further in this video we will learn about the fetal conditions which can lead to death. The third most common condition which could lead to intrauterine fetal death is placental causes. After that there are maternal causes and some iatrogenic causes which can lead to intrauterine fetal deaths. So first one, we are going to learn about what are the maternal causes which can lead to intrauterine fetal death. So there are many causes like hypertensive disorders in pregnancy, diabetes in pregnancy, hyperpyrexia, antiphospholipid syndromes, thrombophilias, abnormal labor, postpartum pregnancy, and systemic lupus erythematosus. So we will learn each points in some detail why there is the risk of intrauterine fetal deaths in these conditions due to maternal causes. So first one is hypertensive disorders in pregnancy. So what happens actually is, uh, this is the blood vessel supplying the blood to the fetus. So what happens in hypertensive disorder is there is a spasm of uteroplacental circulation. So there is decreased blood flow which is being provided to the fetus, which lead to accidental hemorrhage and acute red infection, which could lead to fetal demise. So basically there is decreased blood that is supplied to the fetus, which can lead to intrauterine fetal death in case of hypertensive disorders in pregnancy. The second one is diabetes in pregnancy. In diabetes there is multiple pathologies, but last final event being the hypoxia and lactic acidemia, which could lead to fetal death. So most commonly in diabetes, the patient with poor glycemic control, vasculopathy, ketoacidosis, superimposed preeclampsia, and fetal macrosomia are more prone for the intrauterine fetal death rather than other patients with diabetes. So what happens in diabetes is there is a hemoglobin which is glycosylated, which carries less oxygen molecule and also binds O2 more avidly and release O2 less, which can lead to fetal hypoxia. Other factors which are involved are placental villus edema, fetal polycythemia, and hyperviscosity. These are the reasons why, if patient has poor glycemic control, leads to fetal death in diabetes in pregnancy. Third one is the maternal infections. Infections like malaria, hepatitis, influenza, toxoplasmosis, and syphilis are known causes for the intrauterine fetal death. So in malaria, what happens is there is a placental parasitization, which leads to a blockage of intervillous spaces and diminished blood flow to the fetus. So fetus gets less blood and leads to death of fetus. Same causes are associated with hepatitis, influenza, and toxoplasmosis. While in syphilis, there is a placental villi becomes bulky and increased cellularity, so that vascularity being diminished. So in infection, overall causes is decreased blood flow to the fetus, which can lead to intrauterine fetal deaths. Third one is the hyperpyrexia. There is no specific reasons given in the books why there is fetal death in case of hyperpyrexia, but according to some senior doctors, there is release of inflammatory mediators which have pathogenesis in intrauterine fetal deaths. The fourth cause is antiphospholipid syndromes. What happens in antiphospholipid syndrome is, while mothers have the lupus anticoagulant and cardiolipin antibodies, which can lead to decidual vasculopathy with fibrinoid necrosis. So there is placental vascular atherosis and intervillous thrombosis, which leads to intrauterine fetal death. So what happens in antiphospholipid syndrome basically is, this is the blood supply taking blood from mother to fetus. So in antiphospholipid syndromes, there is decidual vasculopathy with fibrinoid necrosis. So there are small fibrinoid necrosis and placental vascular atherosis. So there is atheroma formation in the placental vasculature and intervillous thrombosis. There is also thrombus formation, which decreases the fetal circulation, and by this there is intrauterine fetal deaths. The other causes are thrombophilias. The mechanism is same which we learned previously in Epler syndrome, but in this there is a factor 5 laden protein C and S deficiency, hyperhomocystinemia, which leads to intrauterine fetal deaths. Other causes is abnormal labor. So what happen in abnormal labor is when there is prolonged labor, which leads to hypoxia due to diminished uteroplacental circulation and intracranial hemorrhage, which can cause IUD. Normally, what happens is by natural mechanism, the fetus can survive normal process of labor, but in prolonged labor, the fetus cannot take that much stress and leads to hypoxia and intracranial hemorrhage, which can cause intrauterine fetal deaths. Second cause is obstructed labor, in which there is also asphyxia and lactic acidosis, which can cause intrauterine fetal death, and in other causes when there is ruptured uterus. When the previous LSCS lady present with labor pains, labor in previous LSCS, there are high chances of rupture of uterus, which can basically decrease the fetal circulation by the abruption or any other causes. So there is also a chance of intrauterine fetal death in case of ruptured uterus. Other causes is postpartum pregnancy. What happens in postpartum pregnancy is there is diminished placental function. What happens is placental aging occurs. There is calcification seen in the placenta and infraction seen in placenta, which can cause the decreased blood flow to the fetus, and intrauterine fetal death occurs. There is also a decrease in amniotic fluid in postpartum pregnancy, which are causes for intrauterine fetal death, and there is also meconium passing by fetus in case of post-term pregnancy. This can also lead to intrauterine fetal death. Other cause is systemic lupus erythematosus, in which there is a pregnancy-induced hypertension, intrauterine growth restriction of the fetus, and stillbirth are seen, which are high risk factors of intrauterine fetal death. So other causes are the fetal causes. There are several causes like chromosomal abnormalities, major structural anomalies, infection like chorioamnionitis, Rh incompatibility like hydrops fetalis, other causes like non-immune hydrops, and growth restriction, in which there is hypoxia and acidosis occur, which can lead to intrauterine death of the fetus. So what is non-immune hydrops? Non-immune hydrops is in itself is a different topic. By definition, non-immune hydrops is when there is accumulation of extracellular fluid in tissues and serous cavities in condition other than Rh incompatibility. So we know in the Rh incompatibility there are accumulation of fluids, but there are several other causes in which there is accumulation of extracellular fluids in tissues and cavities, which is known as non-immune hydrops. So what are the causes for non-immune hydrops is chromosomal anomalies like trisomies 13, 18 and 21, Turner syndrome, triploidy and aneuploidy. Some cardiac lesions, congenital cardiac lesions are like congenital heart block, hypoplastic left heart can cause non-immune hydrops. Some congenital abnormalities like cystic hygromas, some placental and umbilical cord pathologies like twin to twin transfusion syndromes, some maternal diseases like severe anemia, which can also cause non-immune hydrops, and some other reasons like CNS malformation are also reason for non-immune hydrops. These all things can lead to intrauterine death of the fetus. So third cause is the placental causes of intrauterine fetal death. There are several pathologies which affect the placenta and causes the problem in circulation and other reason which can lead to intrauterine fetal death. The first one is antepartum hemorrhage, like placenta previa and abruptio placentae, which can lead to acute placental insufficiency. See, acute placental insufficiency. So what happens is in placenta previa is there is a placenta lying close to the os, which sometimes during the labor it gets detached, and there is a acute placental insufficiency which can cause intrauterine fetal death. What happens in abruptio placenta is there is a premature separation of placenta from the uterine wall. So when there is no blood supply to the placenta, how placenta can supply to the developing fetus? So in which there is also placental insufficiency which can cause death of the fetus. Some cord accidents like prolapse of the cord, the true knot of the cord, when there is cord around neck, like tight cord around the neck, which can compromise the fetal blood supply and leads to death of the fetus. There are syndrome like twin to twin transfusion syndrome, in which there is one twin supplying the blood to the other, and in which the supplying twin is depleting of nutrients and every other thing which can cause demise of this fetus. And other causes like placental insufficiency in case of PIH and other related causes, in which there is risk of intrauterine fetal death. As we discussed, most common cause is idiopathic. Around 25 to 35% causes are idiopathic. The cause remain unknown even with through clinical examination and investigations. There are IUDs are seen, and some are iatrogenic causes. Iatrogenic are due to healthcare provider, like external cephalic version. When the baby is in breech, like when the head is up and the baby's legs are downside, we try to rotate the baby so that her head go down toward the cervix and the rest of the part is on fundus of the body, fundus of the uterus, so we can process for normal deliveries, in which there are high risk of abruption and other related causes which can cause acute fetal distress, AFDs, and cause IUDs in cases of external cephalic version. There are also reason of drugs like quinine given beyond the therapeutic doses cause hypoglycemia, and hypoglycemia causes acute fetal distress and IUDs. So these all are the causes of intrauterine fetal death. I know you liked the video and got some really insight information about the what are the causes of intrauterine fetal death. If you find this video helpful, please give a like and subscribe to the channel. In next video we are going to learn about how to diagnose intrauterine fetal death. Until then, tata, bye bye.